Good afternoon. Thank you for tuning in today to our quick virtual care webinar. Today we're going to talk about how many secure mail messages is enough or are enough. And with me today, as always, is Mark Ayer, who will take us through a demonstration. Before we get into it, just quickly, housekeeping, audio settings. Make sure you're switched to computer audio like this, or you're dialed into the phone number. No audio, you won't be able to hear us at all, and you probably can't hear what I'm saying right now. I'm Jeff. Mark is with us again today, as I said, to take us through a demo. We've been working with clinics at Brightsquid for a little over 10 years, helping them with virtual care workflows, how to get them set up in your clinic, and Mark's going to show you that, and we'll look at one sort of specific use case that's a little bit flexible in how you apply it and what you do with it. But first, we want to talk about, you know, people start using secure mail and it's hard to think about what you can do with it. And from that perspective, we really just want to set up the expectation of how many messages could you or should you be sending with secure mail. When we ask our clinics what communications they're sending out already that aren't secure mail messages that maybe could be, we hear them say this. So the typical, this is a GP clinic, and this is across the spectrum of providers that are on the secure mail system. They're sending about 44 referrals a month. They're mailing about 68 patients to messages, or 68 letters to patients a month, and they're emailing emails through traditional email, which obviously is not at all recommended and somewhat illegal, containing personal health information or private health information of the patients 88 times a month. So all of those types of activities can be replaced by secure mail communications. So if you look at that, we're up around the 200 message mark. There's a ton of efficiency that clinics get out of that. We know that clinics that stop sending referrals through the mail and use secure mail instead are cutting the time it takes to process those referrals down by about 75%. And depending on how many referrals you're sending out, if you're hitting this average of 44 a month, that can add up to about a month a year of saved administrative time. So that refocuses staff time on more impactful efforts rather than printing off documents or images or other things and sticking them in envelopes. Clinics that we talk to who do this also do a significant reduction in consumables, and we'll look at that next. So we talk about what are the benefits of doing that, moving those existing communications onto secure mail from other places. This keeps all the information digital. You don't have any degradation of quality when you're printing things off or compressing them to send through email. You are able to send 500 megabyte files, and Mark will show you that. So really any kind of diagnostically relevant communications and files can be sent. We know that by doing this and using secure mail, there's a lot of research on secure messaging with patients that spans the last 15 to 20 years even, that clinics and healthcare organizations around the world have been doing this. We know that you can improve patient outcome measures. So you can actually help your patients be healthier by providing increased access. We end up with increased treatment adherence, and you can look on our website. We will have soon on the patient page. So we started doing some webinars with patients when we have patients come on and talk about their experience and help other patients kind of figure out how it fits into their healthcare regime. And that increased treatment adherence is great for families. Anybody who wants to talk about, hey, what happened at the doctor today, honey, with their spouse, or what did the doctor tell you when you took our kid in? You don't have to try and remember those things or scribble down notes. Your clinic as a patient can send you that, which now you have a reference point. So you're a better patient, you're more engaged, and you're able to follow the advice of the clinic much more closely. It also shows improved patient engagement. There's a ton of follow benefits for that. We know that clinics that use secure mail in their practice are able to increase their capacity for patient encounters by 11% per day. We have clinics that have actually doubled the number of patients they can see in a day with some preparation things that they do. And Mark's going to talk about that, I believe, through the demo. The administrative efficiencies are actually significant. So we have a number of clinics that use secure mail, as I mentioned, replacing mail, replacing fax, all that kind of thing. And they're saving literally thousands of dollars a month because their printer ink is no longer a massive budget line. I just had to order some from my personal printer at home, and it seems like it's almost a weekly occurrence now that I'm printing off sheets for my kids and all this stuff. And it's quite expensive. We can reallocate time, as we said. We have a reduction of phone traffic. So those 200 messages we looked at before, that's not all new communication. That's just replacing things. And we're getting rid of that inefficient phone communication. We can't leave voicemails in healthcare that are effective or deliver any kind of real information. And we end up having this game of phone tag. And I think the average is about 5 to 7 attempts or contact points when we're trying to do phone communication now, because people don't answer their phone. They wait for a voicemail, or they expect to use text or email or something like that. And people are more comfortable doing that because there's no alignment of schedule. So by moving those sort of 200 communications that you're doing already, you can look to get some of these benefits in your clinic as well. And I will point out that this 30% reduction in phone traffic doesn't happen when 100% of your patients are on board. That's not even really a realistic expectation. We've seen clinics achieve that target with 25% of their patients on secure mail, messaging them through secure email instead of using the phone. So common workflows, and we have a lot of these types of documents where we look at something that happens in the clinic, a regular kind of thing that needs to get done, and here's how you do it using secure mail. So if we look at this chart, this is all about sending and receiving pre-appointment forms. And there was the one clinic I mentioned, by doing this process, was able to double the number of patients they saw in a day, because this was a specialist clinic. They were spending on average 20 minutes per patient. And they actually, by collecting a lot more history up front, providing the physician with that information before the appointment, focused the conversation a lot. They were able to clear away a lot of that history conversation in the interview that they were doing. And the patient was better prepared for the interview or for the appointment because they knew what was important, what was relevant. They'd put some thought into their concerns in advance. If, for example, if they're there for migraines, they'd thought about how many migraines they'd had in a month. They might have talked to their spouse about it. They've thought about, well, what was I eating or drinking? What was my sleep like? What was my exercise like? They'd had time to do that and respond, rather than trying to scribble down answers in the waiting room when they showed up just in time for their appointment. So you're showing people are showing up on time for their appointment. Your schedule's running better, and everybody has more information. So everybody's contributing in better ways. So in this case, it's easy for someone on your front desk staff, someone on the team, through the shared inbox, to attach a pre-appointment form as a PDF, send it off to the patient to their secure mail account. They can grab the form, download it securely, fill it out, attach it, and send it back. In that point, staff is going to take it. They can attach it into the patient record, put it in, the pre-appointment notes, whatever needs to happen to make sure that that information is now in the hands of the physician, so they're prepared going in. And you can see down the right-hand column, there's not a lot of work involved. Mark will show you what it's like to attach a file. It's really simple. We don't have to worry about printing stuff off and scanning it. If you've got a digital file, it just slides right into a secure mail message. And for a patient to download the pre-appointment form and fills it, that's their time. It doesn't take long to get a file and download it. It's the filling, that takes a place on their own time, kind of as they can. And like I said, they put the thought into it. So let's look at that and what it actually looks like from a demo perspective. Mark, I'll turn things over to you. If you want to grab control, and we'll take a look at how that works.
Yeah, sure thing. Thanks very much, Jeff. So I just turned on the screen broadcast, and while that's loading up for everybody, I just want to repeat something really important that you mentioned a few minutes ago, which is, those 200 activities you're doing through Secure Mail are not 200 new activities. It's 200 things that you're already doing, but now you're doing them so much more quickly and so much more efficiently. And I've been doing this now for almost 10 years, advising medical practices in every channel or industry, from dental to family medical to specialist. allied health professionals, and everyone has that same issue with, sending or making phone calls. And when I introduce secure mail, often the questions are, well, I'm used to using my phone this way. I mean, why would I change? And it takes a little bit of a learning curve to adapt to a new system. But when the advantages are this obvious with secure mail, how much more quickly and efficiently you can communicate the same information, there's really no reason not to switch. It just takes a little bit of commitment at the beginning. So my screen broadcast should be up for everybody right now, and I've only got a few minutes here to do a really quick demo, but I'm going to show you an example of what I can do. So I'm logged in now as an MOA, and I need to send a pre-appointment form to a patient, which was the example that Jeff gave a few minutes ago. So I'm going to compose a new message, and you can time me if you want. I'm going to compose a new message. I'm going to address it to a patient of mine named Adam Abel. Now, Adam has used SecureMail with our practice before, so I can very quickly find him in my address book of connected patients. And I want to send him the pre-appointment form. Dear Adam, please fill this in and send it before your appointment on Monday. Clara. Now, pardon my typos. I'll quickly fix those with the spell checker. Then I'll attach the file that I want Adam to fill in. In this case, I have a PDF document. It's available locally on my computer. It could be on my networks drive somewhere. In this case, I've got it on my in a specific folder, and it's called the pre-appointment form for neurology or neuro. And I'll double click on this, and that's attached. Now, before I click send, I just want to double check I've got the right file. I'll just quickly preview this message. Actually, that's going to add more time, so I'll just go ahead and send it. And then Adam will receive an email notification from the Brightsquid system that says, Clara at your doctor's office has sent you a new secure mail message. Click here to go and see it. So now Adam can receive that information. He can download that PDF document, fill in all the questions. So in a neurological example, we may ask him things like, how often do you get migraines? So when's the last time you had one? Do you see aura? All those questions, like Jeff was saying, if you're thinking about it in the last second, in the waiting room as you're waiting to see the doctor, it's really hard to get all those details clear in your head. But if you can fill this out at home, at the dinner table, with your family around you to help you answer some of these questions, you get much more accurate information. And by the same token, once the doctor then has that information on his side or her side, before they even see you, they're going to have time to absorb that information and provide you a more appropriate feedback much more quickly and efficiently. So now that we're back to our shared inbox, I have another message here from Barney, another patient of ours, and Barney sent in a consent form. So here's how it looks from the other way around. I can open up this message that Barney has just sent me. Now, in this case, it's a PDF document. We can open up and view this PDF document right in Brightsquid, so I can actually view a preview of this image. But the more likely scenario is that I'm going to download this file, save it first to my local computer, and then drag and drop it into my EMR so that the doctor has access to it. I could even go so far as to just forward the entire secure mail message on to the doctor so that he would have the information in his secure mail inbox. There's a couple different ways that these different things can be accomplished, but I think you'd agree that whichever path works best for your practice is going to be more efficient than lick a stamp, old-fashioned mail, half a dozen phone calls, or asking our patients to fill in a form in the waiting room in the last 4 minutes before they go in to see the doctor. This has the advantage of more clear information, more efficiency of care, because as Jeff mentioned, in the examples that we've studied, practices are able to see twice as many patients this way. And it's just more comfortable for our patients. Now, this is an example with a PDF document. If I go back to my shared inbox and I look at another message here from a different patient of mine named Fred, Fred has sent in a photograph, in this case of his hands, because maybe he has eczema or maybe it's dermatitis, I don't know. Now, does Fred still need to come into the doctor's office so that I can prescribe some sort of lotion? Maybe. Or maybe I can just send that prescription to Fred's pharmacy and he can skip coming into my practice altogether. And depending on the jurisdiction that your practice is in, now I'm in Alberta, so that's where I have my area of expertise, but in Alberta, that would be a billable event as well. So I more quickly I'm able to get the answers back to Fred, and it's a billable activity so that I'm not, I'm still getting all the benefits that my practice needs to continue to practice, so to speak. At any rate, that's the end of our time for today. I'll turn the mic back over to Jeff, and you can wrap up there, buddy.
Thanks, Mark. Sorry, I took up a bit of time there at the beginning, but yeah, we got through it. I just want to address one quick question that came in before we go. And that question is, how do clinics handle the number of inbound patient messages? And I will say that, we look at the ratio between send messages and received messages from patients. It's about 3 to 1. So clinics on our system are sending 3 times the messages to patients that they're receiving. The idea does exist, and we've got this question for for years since Brightsquid has been around. I think, Mark, you could probably verify that
Yep.
how, patients are going to bury me under a mountain of email messages that I'm going to have to deal with, and that's simply not the case. And if you go back and look at a lot of the research that's out there that's been done, it shows that as well. There's a number of different projects that have looked at tens of thousands and hundreds of thousands of messages, and really seeing that it's manageable. I think the average across a number of research projects was that clinics typically receive about 5 to 6 messages from patients a day, not a huge heavy load. And I think the average is about 2/3 of those might require some sort of clinical assessment. So that's kind of what you could expect in addition to those 200 messages that you're sending out. And all of those, again, like Mark just showed you, there's a tremendous amount of efficiency efficiency that gets introduced.
And Jeff, if I just may really quickly interject here, in terms of the incoming messages and having to manage all that in your front desk, given my druthers, I would far prefer to get 25 emails in a day than 25 phone calls. It's
Mhm.
way easier for my team to split up incoming emails, manage them in an extemporaneous way, rather than having to answer 25 phone calls, because that phone is ringing and it has to be answered right now. An email I can answer in a minute, 2 minutes, 5 minutes, an hour, and still give the patient the experience they're looking for.
Yeah, and it's
Back
very
to you.
difficult to forward a phone call to the physician, right? When they're
Yeah,
when they're
exactly.
busy seeing patients, conducting their encounters, and this gives the ability, as you said, to address it, and you can. I will point out before we wrap up here that you can take secure mail training. We run it twice a week, Tuesdays and Thursdays at noon Mountain Time. You can sign up through the Brightsquid website. If you just click on the secure mail tab, there's a little drop down that comes down, and you click on secure mail training. You can pick a date that works for you and sign up. And we'll go through an in-depth process to show you how to set up your clinic and get your virtual front desk configured so that Secure Mail is working for you as efficiently as it can. Thanks for tuning in today. Thanks, Mark. Any final words?
Nope. Thanks, everybody. Have a good weekend.
Happy Friday.